So, welcome to the third talk in the Department of Family Medicine Going Around series. I'm Nina Maestera, co-chair with Dr. London Breedlove for this series. We appreciate your attendance both remotely and in person, as well as your engagement and support as we reinvigorate the Department of Family Medicine and Grand Rounds. Thank you as always to our tremendous administrative support from Nicole Jana, as well as our IT staff that we have in person today supporting us. We'll be taking questions from attendees in the room as well as for those who are remote. Please submit your questions via the Q&A function. And then any administrative audiovisual concerns through the chat, please. With that, I would like to introduce our speaker for the day. Dr. Danielson was the medical director for Community Pediatric Clinic for 2 decades. He continues to promote the well-being of young people by trying to catalyze efforts to end youth incarceration. Dr. Danielson works with entities at the community, local, state, and national level to promote equity. He has benefited from co-conspiring with brilliant youth and an abundance of compassionate people, and he realizes he is often the least useful member of the system. He has been married to the love of his life for 17 years, who for some reason agreed to marry. So welcome, Dr. Danielson.
Slightly different introduction. Maybe that's my disclosure too. I definitely feel like the least knowledgeable person in this space, so I hope you'll bear with me and whatever grace you grant around things I'm missing or things that you want to share, please do. Please interrupt. I want to make sure there's time to talk afterward, but if there's something that's striking to you here or virtually, I just would welcome your curiosity and your thoughts, your pushback. I love to learn and would love to learn something more. Also, just gimping around a little bit. I had a total hip replacement yesterday and feeling great, great. But I'm still looking forward to moving better in the future. But if I'm like looking or grunting slightly or something like that, I'm happy to talk a little bit about sort of just what is a learning journey in thinking about issues of equity and anti-racism. And I'm really curious about what things you're wrestling with, where this touches and taps for you, and where it seems like it's a mess. So love to hear what you have to say. Also, extremely guarding and sort of supplementing my inarticulate skills, but just trying to put some beautiful artwork in front of you so that if you get bored while you're eating lunch or something like that, at least you have some images to look at and to share that way. We're talking about work around equity, and it's a challenge sometimes, right? To get in the space of being able to talk about it as an abundant and joyful and powerful thing, and also be very truthful about the tragedy that in so many ways are our systems and our ecosystems and the ways in which they have been so built upon racist and oppressive values and norms and DNA that that's real too. I'm trying to get good at this point in my age, and most of this talk is about things I'm learning. And I'm holding these 2 truths about joy and pain at the same time. And I'm not sure I get that right, but I like the idea at least that we don't have to necessarily decide whether something is all good or all bad, or whether we are going to be stuck in one space in our emotional state relative to what I think is really beautiful human work, which is what inspires me about what you all do. You all inspired me to come out to Seattle, by the way, when I was applying to medical schools. I think it might be still true, but the University of Washington was like #1 in NIH funding and like #1 in family practice preparation. And I think you're always near the top of that. And I'm like, wow. I went into pediatrics, but it was very clear to me a space that was doing both of those things really well was going to prepare me to be a halfway decent doctor. So I want to talk a little bit about all of this stuff from a bit of curiosity and a bit of thinking. It always makes me go back to this question of, well, who gets to write the books? Who gets to tell the stories? who actually gets to name what happened and how it happened and why. And it feels like right now we're in this pretty strong battle around understanding whether or not it's even allowable to share a truthful history with young people, whether or not we can even consider the ideas, that maybe the ways in which we learn things, the narratives that I learned, maybe some that you've learned could also be wrong, could be off. And how do we sort of revisit that and think about that? I'm really curious about who gets to say, who gets to write the words, whose words fill up our sense of how we know who we are and what we do, especially when we talk about issues of harm being done from one group of people to another, or understanding the strengths and beauty that exist in the communities around us. For one, this is kind of the way I'm going to talk about it for the next 40 minutes. That curiosity, gets really powerful. Sometimes you think we're in the Seattle area, we're in the Pacific Northwest, and we get to sort of watch from the distance as some issues play themselves out around access to health, reproductive health care, about how we can or can't make decisions about admissions policies and things like that. It's really worth noting that we really recently had the experience in Dayton in Eastern Washington, the threat to actually close a library in order to make sure that young people that actually learn, or adults learn their true history, true stories of this country. But that's the level of fighting that's going on, and it's not just something happening in a southeastern state or something. It's something that is part of our reality and our consciousness. I'm curious about whether or not you're starting to feel a closer impact sometimes of extreme policies, extreme approaches that try to constrain what you can and can't talk about, or who you can and can't bring into your spaces, and how you can grow with that. Who gets to say and who doesn't get to say? Whose voices have been locked up and kept behind for so long? How do we think about not only the importance of lifting up other voices, but maybe what we owe for the fact that we were repressing, suppressing, and oppressing those voices for so long? About how to how we start to try to find our own voices in this work, how you find your voices. Can I just say, I'm in a cool space right now because I look up on the wall and I see a core value that you celebrate the unique and revolutionary power of family medicine as part of your core values here. I want to hang out in spaces like that. I want to be in spaces where the idea of celebration, of understanding your power, and of it being part of maybe an evolution with a little R in front of it, because you're working from the insides to make things grow and change for everyone. I really appreciate, I love the radicalness of that. I love that you say that very clearly and plainly at the wall. That voicing is hard. It's not always easy. I know I've sucked many times at finding my voice and speaking out. There's times when it's been important. I've been pretty much on par for speaking up when I should be quiet and being quiet when I should be speaking up. And I don't know what your experiences are like, what you're learning about yourselves through that, what you're experimenting with, what you're willing to push for your own edges. But finding your voice, being able to sort of get a little louder, be a bit more unapologetic, be a bit more unabashed in standing up for what you believe in, even as you're going through wherever you are in your professional journeys and in your lives. It's really important. So I look forward to being in spaces like that. I think one of the things that's really powerful about training and practicing and identifying with the people is what you get to share together. Well, sometimes that you can't believe what kind of day I had, but also in the ways that allow you to strengthen your voices, perspectives. Also, these days, I just really want to make sure I stay very clear about why issues of equity and anti-racism are really significantly important. Looking at this study from May that was doing a very strange thing, counting up the unnecessary deaths of what they call the excess mortality for Black Americans in this country in the past 21 years. And I won't actually get into the details of how those counts were done, what they what the methodologies were. I was really struck both by. You ever notice sometimes we talk about the hardest things with the most bland language in medicine, and somehow it seems to make it, excess mortality, because like a term like that, that we should really wonder if that's ethically even the right way to define it. As a pediatrician, I also was really struck by the idea that with not only 1.63 million lives lost during this 20-year period, that should not have happened to Black people. There's already also 80 million years of life lost. Tells me that those deaths span every age range, every potential life year of life lost, including our youngest people to every age. So it's real. Talking about this, inviting someone like me to have and ramble with you all for a bit is not just for some esoteric practice or to help us make ourselves feel good about our political correctness. These are real issues that cost lives. They not only cost lives, they also cost identities and cultures, our sense of our ability to know ourselves, know our ancestors, understand and know our language and the cultures and the practices that make us who we are. Life erasure, cultural erasure. These have been deeply and very methodically practiced approaches to affecting people's lives around us in this country. Our part in healthcare is just a small part of that, but a significant one in so many ways as well. And so it gets me to the space of what have I been doing in trying to work in healthcare, trying to be a decent community pediatrician, trying to think about what my beloved community is asking of me as a Black person. And one of the things I've really had come to is how important language is in these conversations. Probably maybe some of you have heard me say this before, but this realization that we need to be very clear when we're talking about what's happening. I used to talk a lot about the differences in health outcomes based on race. We talked about racial disproportionality. Those terms are actually inaccurate in an important way. These differences in health outcomes are not because of race, right? We know that cognitively, but we see these terms like disparities, health disparities based on race. They're based on racism, not race. And that language becomes really important because for me, at least, I'm talking about solutions, what I need to be doing, how we need to be thinking about how we move in the world, understanding that it is racism, be really conscious and aware of the importance of this words. Something that feels valuable to you in helping us navigate away from things that has kept us trapped in these conversations. Does that make sense? The differences in health outcomes based on racism. And it is still valid, still in both and land. It is valid to use disaggregated data. It's valid to understand impacts in some ways by using categorizations like race. But never let that make you think or drift into the space that you should be correcting for race, or that there should be some solution that's based on race. The solution really needs to be based on racism, if that makes sense, anti-racism. I'm trying to learn on that, and I still slip up with the back and forth between accuracy and fidelity in thinking about that. But I think that's part of our work in really truly being care providers who really care about understanding what those people need from us. Those kinds of learnings are really important, and also important for me to understand that the way I can stand in front of a group of people sometimes and talk about issues of racial disproportionality, racism, disproportionality, about different harms that have happened to communities and to individuals and to families. It can leave you with the sense that the people, the human beings, the souls we're talking about are some compilation of galaxies. And our work becomes very, very, very grounded in deficit thinking, in problem thinking. I made this point the other day, but I think it's just as true. If you're married to someone whose profession is infectious diseases, I just wonder, like, why we don't have someone who's a professional in healthy bodies or in infectious cures or in something different than naming like our identity, our values, our training, the basis for our understanding of the work. Based only on the presence of something bad, not necessarily the presence of something good and strong as part of that process. I don't know what those labels would be, but I wouldn't mind being like, I don't know, like pediatrician and professor of joy. That'd be pretty cool. How do we think about assets and the beauty of what's around us in addition to thinking about the kinds of ways in which challenges show up and which lives are effectively impacted? How do we see the whole picture? And how do we make that sure that those assets are celebrated? That there's an abundance in that sense of celebration and unique and revolutionary power that we hold. It's hard because I don't know if you've seen stuff like this, but the ways in which we bake bias into our work is really challenging. Even for all of us with good intentions and good ideas, we tend to create stories, narratives in the form of electronic health records that are subsumed by bias. When you study electronic health records, you can see, based on racism, differences in the way that we talk about the stories of our patients. And I don't mean that a health record would say something like, I don't like them because it's black. But I do mean that it's more likely in the medical record accounting with them that these are doubters of the world and into the narrative. Patient claims that their pain is a 9 out of 10, even though they're standing before me and speaking clearly and seem to have a common economic place. The ways in which we use language in our own telling of other people's stories to pervade and perpetuate bias is really a powerful one. It's really contemplation. Because these are stories that go on and on. Put these into records, and people we will never meet will read those records and will make an assessment of another human being based on the words that we chose to use in our language. These are important things for us to think about, and the act of actually extruding them and getting them out of our systems and approaches is really, really hard. I was really struck by one of the leaders in the pediatric field is this, I was gonna say, dude, this doctor named Joseph Wright, who's in the Academy of Pediatrics. It's done a lot of really important groundbreaking work. It's been one of our invited speakers to our Odessa grand rounds past years. And with a group of people in the academy, I think they were sort of saying, okay, we're going to go into the methodology behind some of our assessments, assays, and tools, and uproot and take out the parts that are biased and that are racist. And the scale of how hard that was the most impressive part of Dr. Wright's kind of early endeavors. It is so ubiquitous, it is so uniquely woven in. It's so weird, right, to see that and think that and know that somebody poured that into you in your training. Somebody built that into the way that you frame and think about things, and someone else's opportunity for something like a kidney transplant is predicated on the ways in which we built tools that advise. How do we start to really examine our own selves in this way? How do we start to have that that mirror, do that mirror work, really understanding how our practices have not just been showing up today, but have been showing up for ages and ages and generations in scoping the way we categorize, we qualitatively, at least pseudo-qualitatively, talk about somebody's wellness or their wellness. How do we start to examine that in a different way? I found myself formed and sort of trying to navigate that space in ways at times. I find myself sometimes also a bit infuriated. It's all like 6 years ago, this study of new medical students out of Virginia Medical School showed that 1 in 6 or 1 in 7 of them still felt like that Black people had fewer pain receptors, that had thicker skin, and they respond to pain in the same way. Really creepy kind of justification for a lot of the ways in which we treat each other. I don't even know if I should be standing in front of you today. I'm fine after this. Like a really weird message to you about what we endure. What we think they're supposed to do. The hard part also for me is knowing how much scrutiny happens when you walk through the walls, through the doors of our healthcare facilities across the country. And what it means to be in spaces where you go from sometimes being invisible across society and images that show up for you and in your media and things like that to being hyper visible for negative attributes when you walk into spaces like healthcare. What does that mean? That was a piece for me that was a breaking point with my relationship to a place that I worked at for all of my professional career that held all of my close, many of my close professional friends and connections. The practice, the ongoing and continuing practice of hyper scrutiny, disproportionately calling security of families because of racism, of treating people differently, and them knowing that and feeling that, and having to walk through a door saying, I know my kid needs to get care, maybe needs to get cancer care, but I have to swallow all of this, I have to hold all of that, and I have to make sure that I am guarded against all of those other things, just in order to get to the point of actually accessing. What is that experience? What do we owe ourselves as practitioners in these spaces and to others in the way some respect care is provided? To change it and think about it. Scrutiny. The scrutiny in the deeper eye is also so deeply baked into the reasons wanted to be more supportive in the space of ending youth incarceration. Because I think that there are people, this took me a little while, so another thing I'm learning, so racism, not race. There are also people who think that the presence of authority is a safety factor in my lives. There are people who feel pretty strongly that being around saying more police makes them safer. I did not grow up in that environment. That was not my experience in any way. And it took me a while to realize that other people kind of sort of thought that. More police around here, what could go wrong? These kinds of understandings and learnings about not every journey is really going to be seen in a way that you would understand. The things that you have learned and trained to be wary and taking on in your own personal life are going to be very different than other people's experiences. I say that out loud, it's so super obvious. When you put it into practice, it just feels like sometimes there's a reminder that needs to happen. The scrutiny and the discretion with which people use scrutiny in our society is actually where a lot of the most harmful things happen. Happy Selena Santos is a nurse practitioner I worked with for a long time, and her husband works in the prosecuting side of the criminal justice system and really seeks for changes. But I think your husband would say there are bad laws, and there's actually sometimes a space between laws and rules, big policies in healthcare that actually allow for more of the bias to occur, the racism to occur, the oppression to occur, than the rules themselves. Scrutiny, whether or not I arrest somebody, whether or not I take them in, whether or not they end up in front of a judge, whether that judge decides to charge, whether or not that charge is, let's just call it a charge to the max, whether or not that person is detained. And let's not make any bones about it in our society. And this is relevant to us in healthcare or any other part of society. Most of the people who we have in jail, in prisons, are actually not convicted of crimes. The majority of people. And those systems bring Black and brown people into disproportionately. Those things have their roots and their threads that connect to education, connect to healthcare in very discrete, very clear ways. All of this stuff is related and is part of this idea of scrutiny and discretion. The discretion to act with greater bias that we need to sort of think about. Self-glorification. I wrote an article a year ago talking about that. You know, I have to read this kind of just said a lot of it just through the eyes and perspectives of families that we've taken care of for a long time, and back in the day, where their parents are there. It's in health affairs, you know, so just a narrative approach to talking about these issues. If, like, really didn't care about issues of bias, and we just cared about issues of financial sustainability, I guess I feel like obliged with some regrets to feel that it's actually costly to be biased in this healthcare system as well, and costs billions and billions, hundreds of billions of dollars, heading towards trillions of dollars to practice racism in our healthcare system. I say that for another reason too, because sometimes I don't think I've met anybody in the healthcare field who would just say, well, let's just do this for the right financial reasons, not for the right ethical and moral reasons. But a deeper point to me is that, and I see it happening right now across our healthcare system, we abandon issues of equity in the name of trying to promote financial self-sustainability. Our healthcare leadership, somebody says it would be nice to continue to have that Office of Health Equity or that program on policy. We can't do it anymore because we just it's just not financially feasible. I guess I also make the point that it is actually financially costly not to be these ads, whatever you it's a good business model to be bad at promoting and purveying bias. These issues are important. I think they lead to some of the ways in which people feel exhausted in our healthcare system. And I think that they are really tightly connected to why, at least in Ipsos polls, which are supposed to be pretty good ways of looking at like 1,000 people at a time within a profession and asking them about it. Well, I think your answers like this, that almost 40% of people like us say the healthcare system is on the verge of collapse. I think there's a moral quandary for us practices that relates to whether or not we are able to be pro-Black, pro-LGBTQIA two-spirit plus, pro-disabled, pro-age, pro and anti-racist in our work. I think that pulls us, makes us feel like we're torn between one set of ideas and priorities and another. It eats away the road, tears down the lining that protects your stomach from acid. It starts to hurt your stomach. I think that that's part of why this healthcare system has, like you can tell me if you feel like there's a layer of exhaustion that you're so lucky into, but I understand this. Almost accepting it as like this is the way it's going to be for this career. We were talking a little bit about the ways in which we sort of create a de rigueur suffering as part of this profession. That most of the time, people, especially with gray hair like me, still talk about the hard things we did. I was on call 98 hours a day for 374 days out of the year during residencies. I shouldn't be complaining about anything. And that is actually those are our talismans and coins of credibility in this work. I think that internal suffering that we sort of get proud about fades into this externalized suffering that is something about other than having a human experience while you're in a real meaningful profession. That makes any sense. These things that we're thinking about. I think we can learn through language of equity about how to really consider the ways in which we create spaces, realities for ourselves and for the people that we care about in this work. So many different ways in which people are both seen and unseen in our healthcare system. Different ways that people disappear and dematerialized or uninvited to have their voices and perspectives. There's so many ways in which if you are harmed by healthcare racism, you're often harmed by environmental racism. You're most likely to be the most negatively impacted by climate change. If you are also the most likely to have those negative words written about you in an electronic health record. These things are interwoven and intertwined. If you are most likely to be impacted by climate change and by healthcare racism, you're also least likely to have opportunities for socioeconomic growth and stability in a country that's very focused on socioeconomic issues and stabilities, and really make that an individualized, or at least a family level endeavor. There's a reason why those lines are flat for family wealth for blacks in this country. It takes work to actually hold a line flat like that one. It's a lot of oppression to make sure that that happens. And luckily for you all, now that I've shown you one graph, you get CME credit, I think. The ability to know our stories, to hear the stories as told by other people, questions and experiences that are greater than our understanding. This is the third Marshall School Library, just down the street from the clinic and I worked in, home that I live in. And to know that people see themselves in their stories and our history, I think is one of the most powerful helping tools we could possibly think of. And one of the best ways for us to be fighting back and pushing back on who gets to tell the story of who we are. Learning number 453 from me. So racism, not race. Really different experiences and perceptions about what makes us safe and makes us unsafe in this society. Understanding how important our language is and the way we understand issues, especially in our equity. This one I still kind of like bouncing in and out of. That these ecosystems of ill health are actually working perfectly. I definitely came into medical school thinking I was fixing stuff in systems and fixing people. All of those, I'm embarrassed to say this now, all of those really, really almost egotistical, like I'm here to make a change happen. Very Westernized, almost the idolatry of the one doctor, the person doing something. It still takes me to reminders to understand that none of these systems are broken. We actually kill 1.6 million Black people, 80 million years of life lost. All of the indignities of being hyper-scrutinized, all of this happens with part of a clear design that's working exactly the way it's supposed to. When you think about racism, instead of race, you think about different solutions, don't you? When you think about systems working exactly the way they're supposed to, instead of systems that are broken, you think about different solutions, don't you? Not fixing systems. They don't need fixing, they're actually working exactly the way it is. That makes sense. I mean, it's a sad thing because humans made these systems and they see the effects of them. When I'm in a grumpy mood in the wonderful, kind Pacific Northwest, I linger on this kind of image and idea. Maybe it's longer than I'm learning to see a broader picture around this, but I will admit that I've gotten frozen sometimes in this space of why aren't good people doing more good? What is it that keeps people from taking what may not even be a risk, but is perceived as one, to make change happen? Why aren't we living the lives that we say through our words that we really want them to be like? What is it about us? And is it maybe us good folks who aren't doing enough that are actually causing more harm than those very obvious evil folks that seem to be acting in opposition to our ideas? What is it that keeps us from understanding the unique and revolutionary powers that we have to transform and change systems? I'd love to hear your thoughts about that. What is it that gives us such a short attention span in this country and allows us to move on to the next thing? Declare a picture success or victory in something, or just decide that we're not able to afford to pay attention to that anymore because something else is happening. Not understanding that all of these issues are actually really tightly interrelated. And what do we need to learn about ourselves and our approaches to sort of teaching and learning with each other? I'm really struck by studies like this, like 9 or 10 years old now, I think, that was from the realm of criminal justice that had judges tell the juries, please don't act biased when you go there to deliberate this case. And what happens is the juries are actually more likely to be biased when you instruct them to not be biased. Full denigration of my own reason for talking to you today, because like me talking to you doesn't make anybody less racist. You're already prone to be anti-racist. You continue to be anti-racist. You're prone to think that what I'm saying is just crap. You continue to be affirmed in that direction. There's something about us, our human nature. It's really interesting, just talking about racism in the criminal justice area. Erica doesn't change people's approach to that makes them more racist. And similarly, this study from the sort of height of COVID, when using equity as a reason to be better at practicing safe practices around COVID, actually make people less likely to practice safe practices around COVID. Because that empathy was not something that they tapped into. Like you said, please be more careful because COVID kills Latino and Black people. People are less careful in those spaces now. So we can't just talk about it. We can't just be in spaces where we talk. We're all super busy. We're all on the run. We're all living hectic lives. But we do need to start to see our healthcare system continue to evolve and change. There is, for me, the sense that there are more removing of the masks. I'm allowed to talk to you all about this stuff, which kind of says something that I hope that other Black four male pediatricians who grew up in Washington, D.C. are not actually coming here and living the same experience as they trained as I did, because that would be no progress whatsoever. That maybe a black woman who comes into medical school can actually be her full self, less constrained and protected and carefully guarded self than perhaps a generation ago needed. That's a beautiful thing. How do we make sure we welcome that and create space for that, even when it's extremely uncomfortable, even when it's a big challenge for us to try to figure out how to balance that with other components of our lives? How do we make sure that we actually celebrate the uplifting of the mask and payment for that in the spaces, places where we're learning and training, where other people are having different experiences? I wonder about that. How do we find a way to sort of step out of what we've been told are the things that are in our lane and not in any lane? I'm a pediatrician talking to a group of family medicine folks. Maybe I'm stepping out of my lane to be in space with you. Maybe you invited me out of my lane to talk about something that feels like we should be talking about. What does it mean for us to question even the ways in which we are told you're not supposed to question? And what does that help us do? I think that's one of the core and primal ways that we actually become revolutionary in our work. I think that's one of the ways we find our power and our strength in not working. I think that's one way we celebrate it. How do we find different ways to talk about equity as well? To date, and I think still, and probably I feed into this all the time, racism in healthcare is a diagnosis of exclusion. For the most part, you need to prove that something else is not going on at the same time in order to satisfy a lot of people's brains that the reason for that different health outcome is racism. You have to prove like you have to do this like, well, wasn't it socioeconomics that could have explained that? Aren't these just regional differences? Aren't there other reasons that we must look at first before we fall to the impact of racism? 1.63 million lives in 20 years, I think, should tell us that there's a scale and scope to this challenge of inequity of racism, oppression that we need to pay more attention to. It should be actually maybe the first diagnosis instead of the diagnosis of exclusion. Maybe we should be starting to think about that. And that same forensic way, you think about other healthcare issues. Does that make any sense? I'm learning how to say that. I don't know how to say that well. Yeah, but I'm just trying to push this idea that we still look at other reasons first, even within our own circles. What's the justification? How do I get to lesson number 446 for me about my learnings in this equity journey? I'm still in that space where I hear myself talking about gaps, about disparities relative to differences in health outcomes. And I wonder how to grow away from that, because I think the gap talk is absolutely dangerous. I think the gap talk still makes you think that your work is done when the experience of one group is equal to the experience of another group, let's say, like white privileged people. And so suddenly what you're doing when you're talking about narrowing gaps is lifting up a gold standard of white supremacy. How is it that I'm doing that when I'm trying to talk about issues of racism and equity? What are the things that I need to be changing in my head? Get away from this idea of like, what would it mean that like, if everyone's health outcome was terrible, but the gap was zero. Would that be a good place to get to? Lo and behold, that's kind of the way this country's healthcare system is. You could be pretty privileged and have pretty shitty, okay. Right, and so, I don't know, if I care about a beautiful young black child and the future that they have, that's possible. Do I really want them to just get to the point of being as shitty as other people? Is that really what our goal will be? Maybe no gaps, right? Infant mortality here just got as bad as it is for white populations, but we're still one of the worst in the world. Would that be, is that a good thing? Is that a measure that we should be aspiring to? And I also just see so much brilliance in the communities I work, just so amazing brilliance and these families that are doing what they do, kids that have every possibility to be the most incredible contributors to the world ever. If I only said you can only go this far because other people who've experienced privilege have gotten to this place, what am I saying to a young person? What am I saying to our future? And kind of actually making the gap conversation a great limiting factor in how far we work to go. Is that making any sense? I don't, I'm still trying to figure out how to think about that. And what I'm learning in that, because I still talk about disproportionality. I still use that language because it's something that when we talk, you're going to understand me when I say it. I sure don't mean it. I do not mean just narrowing the gaps to zero. I don't think that's a good space for us to be experienced. I don't think it allows us to think about like individual brilliance. And a person who's doing something totally different and has a art that's completely different and could be doing things that you never even thought of. That's a space I want to be in. Does not constrain in that ways. I don't know how you think about this idea. How do we get past gap talk and diagnoses of exclusion and our work around effort? I'm questioning my own narratives. I'm really starting to try to learn to question my own narratives. I'm sorry if you've heard me say this before in some other talks, but I'll say it once again. When I grew up, I had a lot of really great elders who taught me all kinds of life lessons. Wonderful aunties, amazing Black women who looked out for me and weren't afraid to whip my behind when I was in trouble on the streets and stuff like that. And they would give me all of these aphorisms, all of these morals, all these tales. Taught me about the sweat work to be twice as good in this country if you're Black, because you have to work twice as well, or else you will not get nearly half as far. All of those things, including this one, which is kind of Martin Luther had. If you can't fly, then run. If you can't run, then walk. If you can't walk, then crawl. But just do whatever you need to do to keep moving forward. I think I probably like tattooed it that into my inner eyelids when I was studying for medical school and things like that. I feel like that was a big motivator for me. The day I questioned my narratives, I questioned that narrative absolutely. I wonder why, when I'm sitting in a space with aunties and those elders and with you all that I care about, why would I ever ask any one of you to crawl in order for us to move forward? How could that be okay as a motivator or as a narrative that we uphold? What are the narratives that you grown up with? What's something maybe an elder taught you or told you that we need to start questioning? Because I actually think questioning our own narratives is like one of the best ways to be celebrating the unique and revolutionary power that you hold and that you have, and potential in the ways in which you walk the world. Good story somebody told you that you buy into and it keeps you going in some ways, but may actually be built on oppression. I wonder if there's something that we should be talking more about in our space. Fine. It takes a lot of work. I think if I wanted to be a better pediatrician coming into practice right now, I was spending way more time with community organizers than I feel like I had spent some time, but learning how to actually be a co-conspirator to plan and organize and strategize, learning how to find multiple ways to a win instead of I felt a little bad about our profession in some ways. Many parts of COVID when we kept thinking the same way we thought about smoking. If we just give people information and they would know facts, that would somehow be the difference maker. Some other stuff in our game. We need to be learning from other ways of thinking and moving forward and actually see what true revolutionaries do in order to make our own spaces, professions more revolutionary. We need to learn from our history and be willing to think about risks, taking on risks that in the past. These people and so many more were willing to take incredible risks. People who hadn't known each other before, hadn't come from any similar backgrounds, had completely different lives, where they were willing to come together and risk imprisonment for the sake of the right to do something like sit at a department store cafeteria and have a cup of coffee and your skin is stuck. What are we willing to risk today? What are we willing to think about doing? What is our margin for self peril that we're willing to put ourselves towards and even think about? Because man, I don't think I see this in that same way, the way that we move and show up in the world. What do we need to do and who do we need to learn from? What are the lessons that we need to carry on? This was the first medical director of the clinic I worked in, Black Studies, the first Black woman pediatrician in the Northwest. She talked about this idea of quality care with dignity. I wasn't sure I knew what dignity meant when I first started working in that clinic, but boy, do I now know that an incredibly interesting, young, like dyadic, covalently connected idea of both quality care and dignity being the only ways, equal potent ways that we actually can lift up and improve the lives of other people. I understand dignity at a whole nother level now, thanks to people like her and the ways in which she taught it. It makes me hopeful about the ways in which we can actually understand our strongest lessons, question our narratives, get to spaces where we're asking the right questions and move forward in ways that change the way we see what's possible. What's not only possible, but probable for the people around us, the young ones we care about, the adults we care about, our elders, all of those that live in lives. Changes maybe the ways we practice and promoting, like what's operational about equity. So I've been promoting this idea of the equity pause. Has anybody heard this before? Blatantly robbed from the world of surgery, where one of the greatest improvements in surgical safety in the last 25 years was just a clipboard and a timeout, right? Like just pause right before you're about to do that amazing thing of cutting into someone else's skin and you say, I hope I have do we have everything in good? Is everybody ready to go? Do we have things we need just in case things don't go the way we expect them to? How do we account for that possibility? And just pausing there, maybe even like the questions are almost irrelevant, but just pausing before you consider an important decision. If there were an equity pause when you're making an important decision, it could even be a one-on-one, like a patient care decision, or it could be a programmatic decision. It could be deciding whether or not how you write a grant for a project or research protocol that you're putting together. Just pausing, right about to submit this or do this. What's the questions we need to ask? Have the people most negatively impacted by the thing I'm trying to address, have their voices been included in this? Are there unintended consequences I should be thinking about? Who benefits the most and who benefits the least from me doing this, right? I don't even know what the questions would be necessarily. I've watched a few places start to try to incorporate this sort of equity pause into their work. I think it's a really important thing, and I think it's because it's the pause, because we take a breath and we actually have a moment to consider whether or not we're perpetuating oppression and wrong, whether there's some other way to do something that would change that course. I think about other strategies that I find really impressively anti-American in all the best possible ways, like the idea of focused universalism, where very quickly do a curb cutout so somebody who moves differently using wheels can cross the street more safely. And what you notice suddenly is that the mom with the stroller crossing the street more safely through enough time space, and the dude just got a hip surgery. Crosses crosses the street more safely. That everybody starts to cross the street more safely. And that idea that if you do something that is geared towards those most negatively impacted by a challenge, it actually benefits everybody. You start with that. You actually create systems and programs that benefit every single person, including people maybe even very close to all of the privileges possible. We design things that way in our healthcare practices. I think it would look different. I think it would look beautiful. How do we get to spaces where we're starting to do things, that we're starting to work and act on things that are happening even around us right now? our insurers are starting to, I think this is gonna be a huge disaster in lots of ways, but are starting to try to find ways to create sort of population specific plans. So the scan health plan, a woman specific product, which just by its name sounds really terrible. But I think there's it in there, working with Cedar Sinai, and LGBTQIA two spirit plus kind of plan, specific plan in healthcare. Alignment Health is starting to create tailored plans for Latinx, and they still use the term Asian. Who knows what they're talking about in that, but there's work there to try to think about the individual like community needs. Clever Health, all of those are starting to do that. I think they have a dollar motive more than an ethical motive, but I do think that those are things that we should be like learning from. How do you make it easier to complain, to lift up issues and bring them up? I was so pleased to see that this Pittsburgh Highmark Health was just a month ago. We're championing the fact that their complaints about bias went through the roof. They were so thrilled that their complaints went through the roof. And the reason they were thrilled was because they created ways for people to bring up issues and bring them to the floor, not risk retaliation, not risk being fired or pushed out of their position, and actually appreciated that increased the number of complaints and concerns that came up. That's kind of a wonderful thing in some ways, especially if you're in a system that you actually know because it's working exactly as it's designed. It's harming people. Should have a lot of complaints. There should be a lot of ways in which people see something different. Sometimes we look for improvement and we get afraid of what we'll find. I think we need to start to create systems that embrace what we might find when we start to uproot and really look carefully at those things. How do we tell stories differently? How to create spaces so that the narratives are not our words about someone else's lives, but are their own lives as in their own form of expression. I really loved this last fall in the Methow Valley in Washington, how they're creating space for people who had the deepest stake, who were most impacted by the fifth season. You know that term, fifth season, fire season. Tell their stories about how it was impacting their lives. And that display, I really wonder, like, what a healthcare system that actually names the experiences of people most impacted by, say, climate change. Champion that as part of this is who we are. This is what you'll see when you walk through the doors. These are the stories you're going to hear. What would it look like if our healthcare system actually did that? What would it look like if our healthcare system did that? If our healthcare system did that? If it did that and celebrated in that particular way? If it did that and really allowed us to listen and see each other in a way so I think we all came into this field today. If it did that, created a sense of deep dignity. Dignity were actually the health outcome that we were looking for in the ways that we practice. What if you had to say whether or not your plan was going to lift up dignity or not? Just wonder if you would act differently, do something differently, or think about how you approach that care. What do we do when we really understand the importance of community and the work around us? I feel like I don't need to show you this, except that it's a beautiful mural, but this is the way you approach your work, being deeply connected to the inspiration that wells up in the communities around you. What's possible when you start to do that every day, every way in the work that you do, and when you start to use those tools and start to build them into the ways you understand. This is not a gap conversation. This is an opportunity for brilliance to really shine. What do you do when you start to understand perhaps that the ways that we could be less exhausted in our field, the ways that we could change who we are and how we work could be a way that kind of goes against Newtonian law, goes against the law of gravity, and basically says that it's a lot harder work to hold people down than it is to lift them up. It's way easier to lift people up. Maybe we would not be quite so exhausted if we weren't sort of party, whether obvious, aware or not, conscious or unconscious, to practicing oppression as part of our practice. What if we were lifting people up? I think our energy and our time. What if we did things differently? If we were pro dignity in our healthcare records, we had a healthcare record that always started with statements like, John is brilliant because maybe you have to say something like that. Like happy actually expired this week because it's the way Shelf describes the patients in their charts. You think about somebody differently when you talk about who they are as a brilliant person instead of as a weaker person. What if health records had to have an asset list that was 100 million problem list? And programs and the work that we do had to start with the assets in the community, not just the deficits. So rather than what do we do about diabetes, maybe we start our programs based on what we know about the amazing brilliance in this community. How do we lift, strengthen, and support that? What if we didn't have fear of talking about these things? I could hold ideas of joy and pain at the same time. What if we could do all those things together and start to learn about ourselves, use our own reflective practices, and do that be the unique and revolutionary powers that I feel like your profession has lifted up. The reason I came out in Seattle for sure, and the reason I'm really glad and really honored to be in your space with you. I talked a little bit too long, I'm sorry. Thank you again for letting me kind of share at least some pictures. It's more to see.
So we're just happy to take questions. I have a question on the chat that I'm happy to read. Dr. Danielson.
Maybe, thank you so much. And you mentioned the importance of maybe looking not at racism as the last thing, but the first thing. One of the movements over the last 15 years has been our desire, and this has been motivated by many of us in primary care, to look at the social determinants of health. And yet, in a similar vein to what you described, I find that a very sterilely defined group of concepts that don't acknowledge that every one of these social determinants of health is extremely painful to some human being. And I just wondered if you could comment on your own. It's one more example, I think, that we have in medicine, though, of people, I think, with noble ideas of how we can move the conversation forward, yet it also seems to miss the mark a tiny bit.
Yeah, you wonder what's built in underneath that makes it hard for those noble ideas to actually turn out where you want them to. It makes me think about a lot of things around how social determinants can be actually a stacking up of a list of things that you need to consider before you actually fall to issues like oppression and racism. And so I don't think that was the design, but maybe that's been the effect. Makes me also think about how we get so tempted then to solve for individual factors. Please don't ever anybody ask me what's the most important thing kind of question, because I think that that has done us a great service, this service as a professional and as a society. We just take care of this one thing, then the other things will fall, or if we handle this, so this is the thing that I'm comfortable working in. Economic empowerment is what I'm comfortable talking about. I'm not comfortable talking about racism. How do we actually create shields from the real conversations we should have by creating systems that feel like they're ennobling in some ways, but maybe enabling violence to numbers? I wasn't really an answer, but just maybe other people have thoughts.
We have a question on the Q&A. Did Dr. Danielson speak to the projects he's currently engaged in around reducing and eliminating youth in the criminal justice system and the intersection with disability?
Ooh, great question. I wish I had moved it out. Sometime on that last Friday. But yeah, I don't think I could do that justice. That's fine. I do think surprising more healthcare people are more involved in that issue in a more tangible way. And I look forward to a day when the system is demonstrating how racist it is. It doesn't get to exist until we've really addressed that. With reform, we've seen reductions in the number of people who've been in prison. I get the great distinction being a Black man in this country, being born before 1981, which means for me, there's a 1 in 3 chance of spending time in prison. That's for being honest in this country as a Black male. And it is part of my own story, to be honest. And that number has moved to 1 in 5. A Black man born after 1981 is a 1 in 5. A weird sort of progress to think about. But we have systems that have made reforms possible. And I think reforms have been wonderful because it allowed you to envision possibility of actually fully transforming. And also, we've actually increased the racism through those reforms as well. When I first started working in this work on youth detention and incarceration for this area, there was a sort of 6-to-1 sort of amplification of racism. If you're Black, you're just 6 times more likely to be arrested as a youth in this county. Now, even as the numbers of youth who are arrested have gone really down, if you're actually 11 times more likely now to be arrested if you're Black. Like, maybe not the note to end. One more sleep, yeah.
I'm just, I am Valerie Ross. I'm one of the behavioral scientists here, although I'm retired as of Monday. But, but yeah, but so I'm looking for other projects, but it strikes me just listening to you that underlying what you're saying is a complete re-envisioning of how that it's really, and I don't know that then what that is I think as I'm listening for it, I feel like there's a lot of elements around dignity and you talked about brilliance and understanding the community, but I think I think that's what I'm taking. I love the equity pause, looking for practices that help us know how to act and create that definition and act, because having been working as a family therapist in the field for a long time, there's a lot of the system, there's a lot of tension in holding those visions while you're in the system. And I know you decided to step out of the system you were in for a certain amount of time, but I'm just wondering, anyway, if you could say, I think your final slide started to list the things that your vision, dignity and starting with racism and naming those things. But anyway, I just wanted to say that's what I'm really taking from this, is really a call to re-envision health. And that disease and illness, what we often do is a small part of that.
Yeah, or our framing of it is maybe a really small part.
Yeah.
I do think like if we spent half an hour more like creating one more slide, you all would come up with incredibly brilliant ideas. So I always push back on the idea that there aren't solutions to challenges like this, because that's a really easy way to do that sit on the sidelines as a good person to do that. There are so many beautiful ideas and solutions and approaches. I also really push back on the sense that problems are too big, that we sort of enormize them, make them super big, partly so that we don't have to act. I am just a fill in the blank. This problem, racism is huge. I can't make any difference. I think it's really important for us to not let ourselves or our friends off the hook in that particular way. There's so much we can be doing. And I do actually believe, and I didn't used to, learning number 1674 for me is that things like reform and transformation actually can coexist in really effective ways. Go from when I started at the Odessa Brown Clinic, there were 200 Black and brown youth, mostly at the detention center right around the corner from us. By 2019, that number was sometimes 10. It's really hard to talk about abolition when that number 200 is in a detention center. 10 could be 0. 10 could be 0. That's amazing. That's reform and its value. I used to be kind of poo-poo about, oh, reform is polishing around the edges, and it's not. I think all of those are important. And I also say I'm still in, I'm way in systems. And I think that we create false dichotomies sometimes, which actually make it harder for us to work with each other by saying somebody is in and not in, or saying somebody is working from the outside and someone else is working against them. I think we should really question that.
Okay, thank you. I also apologize for I just I made some assumptions about your having stepped out of a system, but I hear that you're continuing to find practices that resonate with your vision and places where you can act on that vision always. Yeah.
As much as I was complaining about my surgery and stuff, it's not supposed to be about me, right? It's about these amazing families that you all get a chance to kind of work with.
Just wanted to say thanks for the insight in thinking about trying to recruit residents and sort of this tension of bringing them into the system that is what it is, and then also trying to empower them to be leaders in that system, and sort of through this framework of healthcare is broken and you can fix it is actually not right at all, and it's really healthcare is working great, but we need to break it. And the idea of recruiting sort of saboteurs, and honestly thinking about it through the lens of like going out as a leader and identifying something that you can sort of, you know, break or dismantle as opposed to fix, actually feels like an almost more tangible lens to sort of look at making an impact. So I don't know, I just say things about it.
I appreciate that. I also have this like wariness that you're making me say it, and it's not actually related to what you're saying. So that's a beautiful thing. When we started the center, Ashe, to end youth incarceration, very intentionally had to have two arms and work to it. Unbuilding the fortifications of youth incarceration, then also building the fortifiers of health and hope in young people. And I do think maybe in our infectious disease, as my title oriented world, the elimination of something that we gravitate towards, and it's the growth and building of something that we really, really struggle to embrace. And I just have a feisty enough mom that I want to sort of embody, that really cares about also like, where are you going to? What are we building? Even as we infiltrate and destroy and break these stuff, like what is the thing that we want to actually build out of that as well? And there are probably a lot of other people who are better at that than me, but I at least want to partner with them and go towards something, not just run away from something. As long as I'm running away from something, it feels like the something is still winning or still naming it. So that one's got it. Absolutely. You had started there.
It's not an important question, but what hip did you get replaced?
But you can't tell.
I wanted to comment that I appreciated the idea of challenging narratives that we carry with us, that can actually be a really important part of your practice or how we engage with this work. I just thought that really resonated.
These questioning, right? Maybe you still keep them, but again, one of the others, again, happy to be too familiar with is like this Norman Rockwell painting of Ruby Bridges walking towards school, right? And the artistry is such that the adults are actually cut off because the focus is on this young person who is stalwart and in perfectly coiffed white dress and shiny pack leather shoes, is walking towards the school. There's a splat of tomato on the wall behind her, a hanger that we don't see in that image. Everybody maybe seen. I just thought that was such a beautiful and powerful statement, and was so amazing. Today, I actually question why we feel okay about placing young people in the greatest danger from our most serious social challenges, and why that would be something that we were lift up as iconographic. At the same time, I think young people are brilliant, stronger than me, and have better hips than these, and have so much more that they can be doing, and to deny them their power and voice is really a mistake. But I really need to rethink that Ruby Bridges image. Also, because spent that whole first year and a half or two in a room by herself, right? There was actually no integration that happened there. None of the other students knew she was even in the building. And because it's just one, and transformation is not a practice of one, it's just still one of those American flaws that we flipped up.
Are there any other questions from?
I have a question online. Can you guys hear me? Am I from the ceiling? I'm Carrie Stevens. I had research here in the department, and I'm a clinical psychologist. And I first want to just say thank you so much for your talk as someone who absolutely identifies with police not being safe, and growing up, as a mixed race person, and having to give my at least one of my mixed children the talk of you're going to get criminalized when you walk in the store, et cetera. Kind of perspective. So just on a human level, thank you very much. And as head of research in family medicine, my question for you, and it's a little bit to put you on the spot, not meant to be disrespectful at all, but I'm just really curious in your wisdom of all that you're sharing, the perspective you're coming from, to hear your advice. on what we can do as a clinical department to try to push for change, whether it's reform or whether it's revolution or whether it's evolution. When we look at research, we do racist things in statistics all the time. Just had a meeting this morning, in fact, right? We have these, do a regression analysis and you reference off of a white group. When we look at social determinants of health and policy and operations and how we're doing that, it comes from often an underpinning of racism that you talked about. I really would love to hear, what do you think a clinical department can do? Like thinking about this wonderful group of people listening right here, what advice would you give to us of what we can do to affect change in that space, given the entrenchment we have, even just from the data up, in continuing to indoctrinate these kind of policies?
A wonderful question. I was with you until you called me wise.
I think any of us with gray hair get to be called that. That's part of the elder culture.
What I think about are some of the elements that I talked about. What I think about is the importance actually of us not skipping steps in the work that we do. So for instance, even as healthcare people who are really thoughtful about how we provide healthcare, we do not work on ourselves enough. We are not reflective enough. We are not using our inner gaze as much as we possibly can. And this feels like a time in professional life when it should be actually so critically lifted up and so invested in, and so that you have time to do that, that you have people supporting you in doing reflection, deep, powerful, painful, hard reflection, because it's sort of counterfeit to go out there with some ideas to change the world without having done the work that you need to do to change yourself internally. Another example for me is that, and again, it feels American, sorry if it sounds bad, but it feels American to want to say that from now on we're going to do good. And I think the most beautiful structure, Mexico City would say this, and so would I think, and is built on a shaky foundation is not a structure that's going to last really well. It's not going to stay upright or erect or vertical. That even the best possible idea, the most anti-racist, pro-dignity, beautiful idea that you possibly have, if you build it on a system, an ecosystem that is still full of all of its historic and present racism, it will actually not work. There is something that really has to tap into this idea of Sankofa and really of going back and actually repairing harms, of actually being accountable and acknowledging damage and harm before you get to do what might be the funner stuff of building something cool and beautiful and different. Those are really big thoughts about what we could be doing. I do like the idea of equity pauses. I do like the idea of people being able to talk more clearly about where your traumas come from and how it does feed into the ways in which we perpetrate trauma on other people too. I really would love to stop in at a lunch sometime and hear somebody talking about a narrative that they absolutely are questioning now, because I think that's a really weird practice. It's kind of interesting. I know you're also surrounded by a lot of love and a lot of incredible hope and possibility. I hope also that even doing this hard work, you tap into your strengths. Your asset list is so much longer than your deficit list. And even when it feels like everything is kind of set up to make it hard for you to do what you want to do, you are way more powerful than you're giving yourself credit for in those moments.
Well, I think we, are there any, anyone who wants to actually chime in from the virtual space, that would be excellent, or in the room. Right, well, I want to thank you, Dr. Danielson, so much for your talk, your insights. This was really wonderful. And there's many comments in the chat thanking you so much for your time and your wisdom.
Thank you.
Thank you very much.
I was going to stick around for a while too. If somebody really wants to nail me for some stupid thing I said. That's very possible.
Thank you very much.
I think I have a reply. I can almost.
I think everything.
I would say if that's the question.
Oh.
Many in residence.
Confident, that's probably.
How's everything going? I feel like I learned.